Well, I'm happy to talk with you about vaccines. The remarkable things really have been implementation of rotavirus vaccine, as well as the use of hepatitis A vaccine. We've really changed the epidemiology of those two diseases with not very many years of use in the United States. We still have a lot more to learn about pertussis vaccines. What we've learned is the best we can do to be sure that children are immunized, but we wish we had better vaccines. It'll take more scientific discovery to understand how we can improve on those vaccines. But the best thing we can do right now is to use them to the fullest extent that they're recommended. And a major problem in the United States, and I suspect you have the same problem, is how do we get doctors who take care of adults to give vaccines that adults should have? Adults are becoming more and more vulnerable to the childhood diseases that they haven't seen since they were children. And so pertussis vaccine, zoster vaccine, influenza vaccines, and pneumococcal vaccines are all things that we as pediatricians have led the way for children, and we have to show our adult colleagues how to do the same thing for their patients.
Hi, I'm Rod Dagan. I'm the Pediatric Infectious Disease Unit Director at the Ben-Gurion University in Beersheba, Israel. And I wanted to say hello to tvcrecer. I believe that adults should be vaccinated against pneumococcus, and better to do it earlier. We know that pneumococcus is a major pathogen in adults. We know that every winter we have death and a lot of disease, especially in the elderly and the immunocompromised. We know that some protection can be achieved in adults through indirect protection from children, but in Argentina, the 13-valent vaccine was introduced very recently, and so most of the adults cannot be yet protected through the children. And they should go and do something active for themselves because they can prevent a lot of problems.